I think the key takeaway here is that research is still important. And again, I'm glad that, the RMC Alliance is working on this, and hopefully there will be more guidelines and direction for the sickle cell community, which encompasses individuals with sickle cell trait. Speaking of research, I want to ask you, what are you looking forward to, when you think about sickle cell trait in general, and also specifically for RMs? What are you looking forward to? What are you hopeful for in terms of research in the near future?
That's a fantastic question. So the one thing that is very related to what we're doing right now is awareness. So we need to raise awareness about sickle cell trait. You've done a beautiful job talking to the sickle cell trait community based on your experience about the overarching concerns of the people with the sickle cell trait community, and raise awareness about RMC as well. Absolutely, both to the sickle cell trait and disease communities, but also to the scientific and clinician communities as well. So raising awareness is key. And essentially, what am I looking for related to raising awareness is lighting up a fire that can be ignited and spread throughout the world, where we can have people thinking about RMC, scientists, and debating. And so that it doesn't have to be that, we are like thinking, oh, why is it the right kidney and the left? But it's like a global debate with people, doing their own research and trials everywhere in the US, in Europe, in Africa, for individuals with RMC, or even for individuals with sickle cell trait. Do trials. What strategy for screening and diagnosis is truly cost effective and beneficial? Those are the kinds of things that I'm looking for, igniting that fire, pushing for this. And obviously, the work that we're doing, trying to harness better the immune system against RMC for those that develop RMC, new therapies, finding new targets for patients with RMC. Those are absolutely the things that I'm looking forward to. And in addition, we identified, we believe, the one modifiable, that's probably the strongest modifiable risk factor, high intensity exercise, but I'm sure there are more. So this one is the strongest one. That's why it came out so cleanly, but there are others. As I said, some people have no exercise history and they still develop RMC. Some people very, very rarely don't even have trait or disease, or a sickle cell trait or disease, and yet they develop RMC. Why? So that kind of research of understanding why is what I'm looking forward to.
Thank you. I couldn't agree with you more. Again, just like we said in the beginning, this was going to be a very informative discussion. And Dr. Misawa, thank you so much. I think for the audience, I'm going to let you all in on a secret. Dr. Misawa, how can people learn and find out more about your work? I've kind of been following your work on social media a little bit, but please let the audience know, because I know that they can definitely benefit from all your expertise. So tell us more about where people can find you.
Yeah, absolutely. And I thank you for asking. I really believe in the power of social media. Now, I myself do not use Instagram, so I'm not there. And in Facebook, I very rarely, talk about RMC, but there is a very vigorous, Facebook community for RMC, and I try to be active there. Interestingly enough, if you know how to look at it and, kind of filter it in a way, Twitter is actually a fantastic avenue for certain scientific information. So we have a very robust scientific community on Twitter. For example, we have debates about statistics and statistical analysis, and about kidney cancer and about other malignancies related to the GU tract. So it's a very, very thriving and very, very interactive community on Twitter. And so, if you search for my name, for example, on Twitter, Pavlos Misawa, you'll find me. There's no other Misaul on the whole of Twitter. So just look at that. You find me, send me a message if you want to connect. There at the same time, you'll find through my Twitter, there are many communities, and more are coming about with, patient advocates for RMC, people that either themselves or their families have been afflicted by this disease. They're organizing and they're doing a lot of fantastic initiatives. We have a video that was made by a colleague, a pharmacist, Bernard Sur, who made a YouTube video about RMC, and it was before we had actually made the connection fully between exercise and RMC, and it was based on a real case that he had seen of a person that did like 500 reps, squatted, and then ended up developing rhabdomyolysis and then developed RMC. So it's a real story. It's a YouTube video. It has been viewed a lot of times. And in there, a lot of the things that we discussed, we showcased them. He did a great job with the graphics that he did, and it helps you, visualize how the cells sickle and the difference between the trait and the disease. So check out that video. Find us on social media, Twitter, Facebook. We'll be more than happy to help. It's absolutely crucial. We believe in the power of social media. It accelerates research and it helps people.